The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
As a former New Hampshire state representative who marched with Dr. Martin Luther King in 1963, he currently serves on the New Hampshire Commission for Human Rights. He's a product of Birmingham, Alabama, where at one time he had to guess how many jelly beans were in a fruit jar just to be able to vote.
We've come a long way, but we're not there yet.
Together we will explore the visible laws, invisible laws, and the structures above and beneath our human surface that keep us reaching for the stars. It is his goal to work with you in putting Nashua back on top, to be voted the #1 city in the nation again.
We are in a crisis situation, and that's what we're going to talk about.
I'm Harvey Key. Welcome to Nashua Strong.
Good afternoon, Nashua. It's good to be back again. It's drizzling outside, so says Representative Rosenwald. So get your umbrellas. It's nice to see you again and glad you're here today because we have something special for you. Usually I want to open this show, and maybe because it was born out of the fact that I came from Birmingham, Alabama, which was so oppressive and suppressive to me when I was a young man, and moved to Nashua, New Hampshire, and got a chance to become a state representative, where I couldn't vote in the state of Alabama at the time because it was forbidden. I repeat that, and some people say, why do you do that? I say I do it because I don't want it to happen again, and it was bad to happen then, and now we're still trying to keep people from voting. I'm on this show because we want to talk about the strength of Nashua, the strength of our state, the strength of our people, the strength of Americans. And as we move forward, in my 86 years on this earth, I haven't seen any more divisiveness between Americans than I see today. And to me, that's some bad news. The good news is that we have a huge number of people in this country who feel differently. And we also have some of those people who feel all Americans are not Americans. But I'm not here to talk about that today, but I just want to remind you that all of the Americans here are Americans. And we talk about the strength of Nashua, and I want to just digress a little bit from that, but I want you to listen closely. In 1998, I had become a state representative in this state, and Ken Burns was at St. Paul's School in Concord, New Hampshire, and he talked about why he was proud to be a Democrat. And I stole some of that. And I'll read some of that to you now. I'm proud to be in a Democratic Party that acknowledges that the strength of our republic is a vigorous two-party system that senses in its gut the infinite wisdom and the genius of our founders in designing a government based on lawful, dynamic opposition, unlike the party, which makes it clear that they would be much happier if they could live in a world without Democrats, without opposition, and without healthy dissent. In other words, that is to say, in my world, without fair dialogue and without the fresh air of democracy. I'm honored to introduce to some of you and present to some of you others the Honorable Sidney Rosenwald, and who's a candidate for state senate, who is, I call her honorable, I called her senator a few years ago. She was not a senator. Now, I've been in this world a long time, and I know when the dearth and the intelligence of someone representing our state and our country are senators. And this lady has what I think, coming from around the Roosevelt time, which you guys don't know much about, she has what it takes. It's not about just the intelligence. I think it's the understanding of what you have. Intelligence has one thing, but to understand what's on the core of the issue is what I think this lady can do. But before I give Honorable Rosenwald the stage, I have one or two questions for her that will give us a closer view of this, what I call a giant of a citizen living right here in our midst. Now, she's brief, she's to the point, she hits the nail on the head, she shoots the bull's eye out of the bull, and I'm going to ask her 3 questions.
Okay, I'm ready.
You're ready. Thank you so much for coming on the show. I am so honored to have you. As you know, you don't know, you don't see it. If you knew it, you wouldn't probably say it. I just am honored to be in your presence. I'll tell you that.
Harvey.
How long have you lived in Nashua?
So it'll be 30 years
30
this
years.
end of July. I moved in 1988 with my husband and my 1-year-old son at the time. He's now 31 and he has a sister who's 28.
How about that?
Yep.
Well, that's great. Where did you come from?
We came from New York City,
New York City. What part?
Manhattan.
Manhattan. Manhattan. You notice she says Manhattan. Huh? How long have you served in the Senate, Representative? As a state
In
rep.
the House. This is my 7th term that I'm completing. I was first elected in 2004, and so it's my 14th year.
Wow. I was leaving at that time.
Yes.
Why did you get into politics?
You know, New Hampshire has been such a great place for me and my family. It's, I can't imagine a more wonderful place to live. We have everything here. We have beautiful scenery. We have a kind, nice, wonderful population. We have good schools. We have good health care. We are close to cities, but we're close to lakes and mountains. And it's just, I've had so much opportunity here that I wanted to try to leave behind what I found when I came here in 1988. And really, that's why. It's a community that's been very good to me and my husband and my children, and I wanted to do my part.
I think I came
try
here for
and live
basically
it.
the same reason. And I've been here I came in 1970. And I think I have found the best place in all of the places I've traveled around the world and all of a large number of places in this country, Nashua, New Hampshire. And it's been proven they're #1 city in the world. In the
Over
state.
and over.
Yeah. And we don't hoot about that. We shout about some other things, but we need to talk about that more, and we're going to do that. Let me ask you this, and this is a kickoff to what you're going to tell us. Is your passionate and active interest in good government one of your strengths to continue reaching across the aisle to the other people who sometimes don't want to shake your hand?
I haven't found it to be my experience that the other side doesn't want to shake my hand, but I think it is a strength. And honestly, I tell people I'm a middle child. I'm not used to getting my own way all the time. I don't fear consensus building, and I recognize that there's really, unless it's a math problem, there's more than one right answer to every problem, and it doesn't always have to be mine. So I think it is a strength. I work often and well with Republicans and also with members of the other chamber. So I've worked with Republicans in the House, but I've also worked a lot with Republicans and Democrats in the Senate. And I've never found anyone who hasn't been willing to at least listen to ideas and thoughts from a colleague, whether we agree in the end
Yeah.
or not.
But I think I've sort of watched you, how you comport yourself. You're persistent in a non-persistent way.
Ladylike, I hope.
You have a certain amount of tenacity that you stick on the bullseye. You're not wavering around issues that don't matter with that conversation. And that is what I call a fantastic understanding of what you're about. And when you're not about that, then you're wavering around the issue, never hitting it on the head. And that's what we are doing sometimes in our society today, because we don't address the issues. We talk about what is around it, and we never get a chance to unravel it or hit it on the head or get to the core of it. So what is it that you think you could do in the Senate to bring about changes? What have you done, Maddie? Maybe let me ask you this from a legislative point of view. As House of Representative, you've worked on several bills that have affected our society in such a big way. Tell us how you've done some of those things.
Well, 2 years ago, I sponsored a bill that asked 7 healthcare licensing boards to work with their members to formulate rules for the best way to prescribe opioids to their patients. So not just doctors, dentists, nurses, because some nurse practitioners have prescribing ability, veterinarians, naturopaths, podiatrists, optometrists, these 7 professional boards whose members have the privilege of prescribing opioids.
Did you go directly to the board, or you have the board come to the House?
We worked with a group of stakeholders, and when I say we, it involved members of the House, Democrats and Republicans, members of the Senate, particularly Senate Republican leadership, the governor's office, Governor Hassan at the time, Attorney General Joe Foster, another Nashua
Yes.
resident, doctors, employees from the professional licensing board structure, some nurses. I think we had some discussions with some of the other members, dentists and
What effect
veterinarians.
have you, after your meeting, this is history, with that board, what kind of effect has it had on Nashua particularly?
Well, I mean, it was more than one discussion. We worked on this bill for about 6 months. And really what I saw during that time was an educational process where the clinicians, mostly the doctors, began to understand that they really played a pivotal role in our present opioid crisis. Because as well-intentioned as they all are, we know that at least 80% of heroin addicts begin their path of addiction with prescribed opioids. Now, they may be legally prescribed for them, or they may be illegally obtained, or they might be legally prescribed for another individual that somehow they get their hands on. But medicines which are supposed to help you have become just a scourge in our community, and Nashua, like Manchester, is particularly badly hit.
How do we rank nationally as a state?
Well, we're somewhere between 1 and 3 in the number of opioid deaths. We are very highly ranked in the per capita consumption of long-acting opioids and also high-strength opioids. And so if we're going to continue this to fight this really terrible public health epidemic, we have to attack it from all sides. We can't just say we're going to arrest all the drug dealers, because not all of the opioids that are harming our people and killing our people. Not all of them are illicit drugs. Some of them are legitimate medications, either wrongly used or wrongly obtained. So one thing we needed to do was say to the healthcare community, it's time to re-examine, using current scientific knowledge and best practices, how you prescribe for your patients. Is an opioid the first approach you should try? Is physical therapy better? Is an Advil better? Is 3 days of a medication rather than 10 days or 14 days better? Don't we have too much supply in our community of drugs that have helped people and will help people, but to the extent that there's too much of them, they're going to harm people? And what we did, the approach that we took in New Hampshire, and what I'm really proud of, is that we didn't go to the doctors and say, we're going to tell you how to treat your patients. We went to the licensing boards and said, here are some areas for you to think about. Set some minimum standards. We're not going to tell you how to practice medicine or dentistry. That's what you're going to do with your licensees. We're going to point you towards, what does the Center for Disease Control have to say? What does the medical literature have to say? What is the FDA going to tell you about these medications? And please, by September 1st, we gave them a short time, we gave them 3 or 4 months. You come back with rules for your licensed healthcare providers. That's what New Hampshire did differently than surrounding states. Maine, by law, said you can only have 5 days or 3 days of prescription medication. We were not willing to tell our doctors how to practice medicine. If we said you can only prescribe 3 days of an opioid for your patient, if they knew going in that wasn't enough, that would require that patient in pain to have another doctor's visit with another expense incurred for that visit. So we worked with the communities to say, how do we jointly arrive at the decisions on how you can rationally treat your patients?
Is that working?
I think it is working. There was some resistance.
Have we been ever number 1, 2 in this country in terms of the opioid crisis?
What we know is that the amount of opioids prescribed and dispensed in New Hampshire has declined over the last couple of years. Pretty significantly, I think, by about 10% year over year. So I think it is working. And one of the ways it's working is that all of these thousands of healthcare professionals who really want to treat their patients well, they're thinking about, I've pulled wisdom teeth on my patient here. How many days is their pain really likely to last for? Do I really need to give them as much as I used to, knowing that they don't need that much? It's a needless expense, and it also ends up with more pills in our communities than people actually need to treat the pain.
Is the police department working with you?
They did not work on this particular project with us, but they've certainly, we've worked with them on other ways to approach the opioid epidemic. And as you know, the firefighters through the Safe Stations program and community providers, harbor homes, they've been instrumental in, if somebody walks into a fire station anywhere in Nashua and says, please, I need help with my drug problem, within 15 minutes, they are connected with someone from Harbor Homes who can help connect them to treatment.
And all they have to do is walk in and say, I need
Any
help.
fire station in
Any fire
Nashua.
station. In,
Yep.
in the state?
In Nashua.
In
We do
Nashua.
this in Nashua.
Okay.
And we do it in Manchester. This program called Safe Stations is a national model for when people are most vulnerable and open to treatment. How do you make sure that you connect them with the treatment at the moment they're ready? And in Nashua, I think we've seen about maybe close to 2,000 people. And they're not all from Nashua. And they're not actually all from New Hampshire. They come from up north. Parents bring their children in.
But anybody who walks in, they don't have to have
Anybody. You don't have to live here.
They just have to be a human being.
They have to be a human being.
That's fantastic.
It is a fantastic
Yeah,
program.
and thank you so much for that work. Now, we got to keep that up because we don't want to be in the top 3, but we're in the top 3 or 5 because of the size of the state. We have 1,300,000 people in this state, and of course, that is not compared to, you can't compare that to Massachusetts, because they have how many million?
Not sure, but they're a lot bigger
A lot
than we
more,
are.
yeah. So the smaller the number, the greater the effect.
Mm-hmm.
And hopefully we can look forward to all of those that you mentioned, and us community citizens, just regular citizens, ought to be awakened to this terrible killer because it kills people,
Right.
and mostly young people, because older people have been afraid, don't have the money, and those people on the street, they didn't make this heroin, they didn't bring it here, and they're the ones who have been in jail. That's who go to jail. Mm-hmm. And I think we may not be hitting the nail on the head because the people who supply this drugs on the street are the people who are making the money. The people on the street are called roaches and mules. They don't make this stuff. They didn't bring it into this country. They didn't bring it into this state. And somehow we have to get after those who bring it and plant it and sell it and kill our young people and our people, period. Mm-hmm. And I know you're going to do something about that when you become a senator.
Well, we've been working on that as well. We have a program here to increase state assistance for law enforcement so we can do a better job. And I have to say that every week I open the Nashua Telegraph and I see drug sweep nets for arrest headlines like that. That is through programs that we've worked on, that I've worked on with Republicans and Democrats, with House members, with senators, to help interdict the drug supply coming into New Hampshire.
Let me ask you this. Some of the younger people in our society, let's call it Nashua, I've been here a long time, don't want to listen to older people who bring stories to them or tell them how to do anything. Would it be worthwhile to get some ambassadors who are younger than 40 or 30 to talk about the dangers of this killer to those people who they want to associate with? And I've gone to places where we talk about problems, and everybody in there has more gray hair than I do, and they don't really care too much because it's not affecting them. I'm wondering if we had someone, maybe we do,
to tell their stories.
Yeah, to tell their stories about how they have been affected and how they have overcome and continue to live and thrive and be successful in our society, to some of the young people who go to the safe stations. Mm-hmm. I don't know if this is possible. It takes money to do these things, and I'm not sure where that's going to come from. But we can't continue to keep going down this rabbit hole and preaching to the choir. I think we have to hit those people in the station that you're going to get this relief from this terrible thing that's going to kill you. You need to help. We're going to keep you alive. Now, is it possible to go to some, I can't even imagine, I can't imagine some session next month and next month to listen to someone who is at Rivier University or at there have to be just young people to tell them, look, this is what I did. This is why I'm still here because of this. And if you do this, you can do this. And then open up the possibilities of how they can not only remain alive, but find wonderful, gainful employment and this kind of stuff.
I think we have some wonderful people who do that work. I've seen a performance of young people telling the story of their own addiction and treatment and recovery. And I believe they take these performances, and they're really gut-wrenching, I have to tell you.
Yeah.
They take them around to schools around New Hampshire. I don't know that they have any funding at all. I think it's a labor of love. I've heard families speak about the tragedy of losing their children. And it's hard as a parent, it's really hard to sit through this. There are people in New Hampshire who have come out the other end and are willing and actually do take their personal stories on the road. And I think there's nothing as powerful as someone's personal story. When it's me talking about someone else's trials and tribulations, it's one thing. But if you hear from that parent the experience of finding their child not breathing on the bathroom floor, I think it's a horror that is every parent's worst nightmare. And when you hear a young person talk about overcoming their own addiction, it's incredibly powerful.
I think that's hitting the nail on the head. I think that's hitting the bullseye. Now, we have to learn how to do that. And we have to have resources to do that. And we have to have volunteers in our general community to do that. And I just am hoping and wishing that when I call you Senator now, I'll call you Senator later, that some of these things can come to pass. Now, I'm on this show for the strength, only the strength of Nashua. Obviously, that gives New Hampshire some strength. I love this state. I love this country. And I am so wanting to help embrace all of the efforts to make us better and get us to the point where more people will come, young people come to New Hampshire and thrive and work and produce. We're looking forward to that. What else? I know you have a long list of things that you've done that you think is awfully important when you get into the Senate.
Well, I'd like to talk to you about the Medicaid expansion, which we've just reauthorized, this time for 5 years. So I think we have realized that this has been a successful program. It started in 2014, in the middle of August. Since that time, about 50,000 low-income adults who have no other qualifying condition to be on Medicaid have been able to qualify for this. What it's done is provide health insurance to a population that was previously largely uninsured. And in particular, it has done wonders for our ability to help people find access to treatment for mental health conditions and also drug abuse problems. We've been told by the treatment community that our best tool for building our capacity to provide the drug treatment we need is the Medicaid expansion. So we started working on this in New Hampshire, I'd say in 2012 or 2013. It's a big lift, and
Yes.
it involved the governors, it involved House health policy people, members of the Finance Committee, and the same for the Senate also. The hospitals in New Hampshire were extremely helpful. The communities of physicians and other kinds of healthcare professionals.
So we have gotten that. That's
we
a
have
success.
done it. It started in 2014. We have now reauthorized it
For
twice.
another, what time period?
This time for 5 years.
That's
So
huge.
That's huge. It does not involve any state funds. Our hospitals and our health insurance carriers and the federal government have paid for this. And in general, at any one time, it's about 50,000 low-income adults. Everyone's an adult, no children, and it's no one who's over 65. So once you qualify for Medicare, it's not for
Not
you.
available.
But in the state in total, more than 110,000 people have been enrolled in this program
In
at
our
some
state?
point.
That's
In our state.
huge.
53,000 people right now in New Hampshire, but in Nashua, it covers about 4,000 people.
What district are you?
13.
13, yeah.
Yeah, but in all of Nashua, about 4,000 people.
What's the
at
population
any one-
in your district?
Well, it's 2/3 of about 90,000 people, so about 60,
Yeah.
about 60,000.
Well, I want you to
People.
know, Senator, I'm calling you that because I want to get used to it. About 90,000 people, hopefully we'll see this. And Dick was just telling me how to get this up on Facebook.
Oh, well, maybe
And-
you can tell me.
Well, we're going to figure that out.
All right.
But because we need to hear what you have done and what and you brought us up to the present. You're going to take us into the future with flying colors. And
Well, also, I want to just let everyone know, this program would not have happened without bipartisan cooperation.
and I think that's key.
It is key because I think really major decisions need cooperation across party lines. It's helping all Granite Staters, not just Democrats. There are a lot of Republicans who are covered by this program as well.
They're called human beings.
Right.
They get caught in that trap called I'm a human being and I have a problem.
Right, I
And
was
it's not
injured.
because you are a Republican or a Democrat or an independent or whatever you call yourself. And somehow we're going to have to get back to calling Americans Americans and get away from those stripes about I am a Democrat or I am this. Of course, you're proud of that. But without us working together, we are a complete failure.
Well, it would not have passed without us working together. And I think that's what we have to remember. This bill would not have gone forward if there weren't both Republicans and Democrats voting for it.
I'm so happy you have come to share some time with us and talk about stuff that is so important and how you hit it on the head and hit the nail on the head. I keep saying this because I'm so serious. I'm 86 years old. So I'm on the shady side of the mountain, they say, and there ain't too much of the mountain left. So I want to make sure that I help you and help all of those people who collectively want to share the responsibility of bringing us from the darkness to the present and then to the future. And I welcome you anytime you would like to come.
Well,
and
thank
I'll
you.
come again. And I can't tell you how honored I am to have you with me.
Well, thank you.
Thank you so much. And anything else you want to leave with us?
Yeah, well, I think we need to face our challenge in New Hampshire of an aging population. You brought it up. We're all on the shady side of the hill.
You don't look it.
Well, I'm getting there too. But we have employers who have jobs open. They need workers. We need to keep our high school graduates in New Hampshire. They need to be able to afford to go to college here. They want to be able to live in New Hampshire and work in their wonderful home state. We need to make sure that good paying jobs are here, that the roads are drivable so people can get to work, that there's rail if someone wants to come up to Nashua or Manchester from Boston.
Now
This
you
is
hit the nail on
very
the head.
important for our business development. And the business community in Nashua is pretty clear about this. Passenger rail is a priority for the economic development of the southern part of New Hampshire, the Capital Corridor. We want our young people to get married and have children. The cost of full-time childcare for an infant in Nashua, $14,000 a year. That's very, very hard for a lot of families. For many people, that's more than they can take home in their
Yeah.
pay. So companies that are thinking of locating want good public education. Full day kindergarten, which Nashua has just gone to this year, is something that companies look for when they're thinking about relocating. The state has come up with some of the funding for that additional half day. There's still a gap, but we were able to work to find some of the money to support full day kindergarten funding. But education doesn't only start. Good quality education starts younger than that. There are only 6 states in the country that don't have any public support for preschool, and New Hampshire is one of them. So I think longer term, it's got to be a priority for us to think, what are the steps that we need to take to make sure we have the workforce of the future? And, we know they've got to be able to afford to go to college here. They've got to be able to afford to buy a house here. They need to be able to afford childcare. They need to be able to commute to work on a road that doesn't have a pothole. My car fell into a pothole in Nashua this winter that was so enormous that my car stalled
Wow.
in that pothole on Concord Street. Now, fortunately, Concord Street's going to be repaved this year. I think that's good, but people are going to be damaging their cars.
Yeah, because you've already almost broken an axle.
Yeah.
Yeah, when you hit the big
In fact,
pothole.
I still have a lingering noise in one of the rear wheels that we can't figure out what the problem is.
I'm so proud of you and how you are hitting this nail on the head because you're talking real language. You're talking real talk. You're not beating around the bush. And I think you have the tenacity and the understanding of the problem. And that's how.
Thank you.
You understand. It's not that you just, you could read and you're literate and you got a PhD. I don't know what. I'm not asking. Don't care.
I don't have a PhD.
It's not important. There are people with PhDs who do not understand what they read. And this is a problem. They have high positions. They don't understand what is really going on with our local community. Or they don't care. I'm not really sure which. Don't really care about that. But I know you from a few years. And to me, when you speak, you speak. When Sidney Rosenwald speaks, we listen.
Thank you.
Thank you so much.
Thank you.
Have a great time.
Pleasure to
I'm
be
so
here.
pleasure, and I want to help anytime. I'm out here, and I got, like I said, I don't have much, but I have something to offer. But I want these young people to be the carriers of the message. Those are the people who behind us are going to listen to. Mm-hmm. They don't listen to people who, this old man, he does this, he doesn't do that. What does he know? And whether I know it or not, but they listen to the young people who can speak to them directly and about their conditions and where they can go. And I think we have a very, very bright future in this state. I'm going to be working with the mayor and the governor and whomever ready to go to work with me to make it better.
That's great.
Thank you so much.
Thanks for having
And
me.
we'll have you again
Great.
more often because your message is on the ball.
Thank you.
Thank you. That's it for me, folks. This is Nashua Strong with Harvey Key and Access Nashua. We want to keep it going that way. And now we have a heck of a lot of things we could talk about that's not so nice. But we don't have time to talk about that. That's a waste of time. Not all times. But we have to know and understand that we get better by being aggressive and progressive and understanding what the issues are and not afraid to talk about them and reach across the aisle to all Americans. Race, creed, gender, and whatever else you want to call it should not be in our vocabulary today, but it is, and we'd like to get rid of it. Thank you so much. See you next time.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.